And healthcare services in public hospitals will be grounded effective midnight if health workers make good their threat following the expiry of a strike notice in what could signify a crisis in the health sector. The health workers have maintained the strike will go on after talks with government this week failed to yield fruits. Kamau examines the demands by healthcare workers, even as the government maintains it has put in place adequate measures to address their demands.
Solidarity forever, for the union makes us strong.
The country is staring at a possible health crisis following the lapse in a strike notice by the Kenya Medical Practitioners and Dentists Union, Kenya Union of Clinical Officers, and the Kenya National Union of Nurses. The unions were issuing the strike notice on varied dates, demanded the government guarantees them a safe working environment in the wake of the pandemic.
You cannot negotiate on matters of life and death.
In a statement, KNUN and KUKO have maintained the strike will go on as planned. On Saturday, KMPDU called for a press briefing on the impending strike, only to cancel it within hours, promising to communicate on the way forward at a later date. This is the third attempt by the health workers since May to boycott services with early strike notices aborting.
They are doing the same thing they have done over the past 2 occasions where we have had to go before them on mediation or arbitration. They are telling us we have to segregate the issues and then we let them handle. And that is the same thing they said in May when we had our first strike that we suspended, and then in August when we actually suspended the second strike.
They're accusing government of doing little to equip healthcare workers who continue to succumb to the virus.
We are seeing now frantic activity to start engaging. So there's a meeting called in the Ministry of Labour yesterday. And the plea is one, and we know we put it very clear, and I put it myself, it's a very clear to one. Can we dialogue? Can we conciliate? But the question is, the experiences that I've just narrated, that are currently ongoing, that are realities, can they wait for another 14, 21 days?
Among the issues in dispute include provision of adequate PPEs, all officers categorized as vulnerable groups be exempted from active frontline duty, comprehensive medical cover, promotions, redesignation, and harmonization of health risk allowance, among others. On Thursday, Health CS Simon Chelugui called on the medics to postpone the strike and continue with dialogue, outlining some of the measures by government to meet their demands, including ordering KEMSA to release all PPEs, NHIF to offer comprehensive medical cover, and setting up of a multi-agency committee to look into health workers' grievances.
Continue to prioritize the safety of our frontline medical workers and ensure that they have the best possible environment to work in, especially now that the country is confronting the second wave of COVID-19.
Despite this, the healthcare workers have maintained they will not cede ground.
We have not had any engagement with the government, more specifically the Ministry of Health and the county government under the COG. And this is to mean that they do not prioritize issues of health in whichever manner.
Since 2010, the healthcare sector has experienced chronic labor-related disharmony, largely blamed on devolution of healthcare. Over 3,000 healthcare workers have so far contracted the coronavirus, with over 33 more succumbing to the virus. It is now a game of wait and see if they will make good their threat and go on strike at a time when the country is battling a pandemic. Kamau reporting for Channel 1 News.